Yeah, thank you very much, and thanks for having me. So I'm a service designer for the Northern Ireland Innovation Lab. So I'm going to be talking a wee bit about service design and also a wee bit about the lab as well. And yes, I'm dying of hay fever, so I've had like 3 antihistamines today. So hopefully this is coherent the whole way through. And also I've got a 10K this afternoon, and I'm actually more nervous about running the 10K than I am about presenting this, which I don't know if it's a bad thing or not. But yeah, just a bit about me. So I did aeronautical engineering at uni. I'm a chartered mechanical engineer. So I worked on design of aircraft parts for about 5 years, over 5 years in aerodynamic design. But I also worked with future aircraft design in Montreal as well. So I travelled back and forth from Canada and America quite a bit to sort of do wind tunnel testing and things like that. So that kind of opened my eyes to user-centered design and innovation. And I was trained up by IDEO. Does everyone know IDEO? One of the biggest design consultancies in the world, probably best design consultancies in the world. So I was trained up by them when I was in Bombardier in user-centered design. So I left after 5 years because if anyone's heard the news lately, Bombardier is not really a good place, and there were a lot of redundancies and job losses. So I decided that probably now is the time to look at user-centered design, service design, and go out on my own. So I've been doing that for about over 3 years, nearly 4 years maybe, and it's been tough. So it's actually amazing now that people are starting to talk about service design, because 3-4 years ago nobody was talking about it. And actually I've never presented at a tech conference before this year. We did a bit of a pitch last year at Beltech, but now I did Beltech, this, and Digital DNA. So obviously people are starting to see it as a methodology that can be used and people are interested in it. Okay, so just a wee bit about the lab. This is probably my favourite photo of some of us in the lab. We are a multidisciplinary team. This is Tony at the front. We were doing a selfie for some like Pi Day, some nerdy, geeky thing. And there is about 8 members now of the lab from various backgrounds. So myself from a mechanical aeronautical background, there's a chemical engineer, there's a politics graduate, an English graduate, we have a statistician who's more like an economic background. So we have a real mix of people in the lab. And also what we do is really just look at non-traditional approaches that government haven't thought of. So I came in 2.5 years ago to the lab as a contractor for 3 months, and I'm still there 2.5 years later. So that just shows you that it's okay. It's mad that the public sector has an innovation lab. I'm not sure that we were particularly innovative, but they were kind of popping up all over the UK and all over Europe. And Simon Hamilton, who was then minister, when we had ministers, decided that it was a really, really good thing to set up in Northern Ireland to see if we could sort of bring this more R&D perspective into government. So really how it works is that a lot of government departments will come to us with a challenge that they can't solve. So they'll ask us if we can use one of our methodologies to be able to help them. We were a free resource since 2014, and actually since then we've had to start charging because there's been so many people coming to us about the work that we do. So we've had to now take applications from sponsors, and we need to review them to see if they're a right fit for the lab, if we can do something innovative, and then we work with them after that. Okay, so when the whole thing started, it was all about this fuzzy front end of innovation. And in government, sometimes that is a difficult part of the process. To me, the most difficult part is implementation, always. But our population is growing, and by 2039, we're going to have an estimated 2.02 million. And there's going to be more and more people using government services, which means we need to be more efficient and we need to be better at developing those services and putting them out to the community. And also, we are becoming more technical, and so we're going away from more paper-based and face-to-face interaction services and starting to look at tech more and more in government. So when we started with that sort of idea generation bit in government, it was great. We brought loads of people into a room for 3 or 4 days of workshops. But actually you're bringing the same people into the room, which means you're getting the same answers, which means you're getting the same solutions, which means they're not going to be implemented because they haven't been so far. What's going to change after having a 3-day workshop? So that's when I came into the lab in 2016, because they started to think, okay, well, how can we take those solutions and actually do something with them and start using design more? So it went from sort of this, we want to find really new, novel ideas, into how can we start developing those ideas. They bought a 3D printer. I have no idea why, because we've used it 3 times. And the first thing I did was make a plane, obviously, in a 3D printer, which is nothing to do with government. But we were trying to get into that more product space, and we were working a lot with healthcare. So we got this in thinking that we would start prototyping in that way, and we haven't, but I really, really have a firm belief that we will start to do that soon. And then we brought a statistician into the lab about a year ago to start looking at how we can trial all of the ideas that we're coming up with, how we can look at data more, how we can get an expert in to get us the data, because that's very hard to do in government. And then this is the hardest part of the whole process. So how do we take those ideas and scale them up, especially when we're a small team in the Department of Finance and we're working with big policy teams in the Department of Health and the Department of Justice and DERA and all of those departments. So we at one stage have to give over our lovely creative ideas into our sponsors and see whether they will go and implement them. So that scale up is really, really, really difficult. Okay, so this is our process, and you've probably seen this. This is sort of the D-School, IDEO, Frog, any of those design consultants. It's the same sort of process that we go through. And it's really just a user-centered design innovation process. So we take every project through a scope, research, ideate, prototype, and refine. And what's very hard to explain to sponsors is that this is not a stage gate process. It's very, very iterative. And actually, when you go and say that we're going to do a project for them, it's very, very hard to predict at what stage you're going to finish, because we might actually get to idea or we might get to prototype and then we say it's not the right solution, so we have to go back in. So it's hard because you have to go finger in the air and say, actually, we need more time to be able to develop this because it's innovative and we need that time. But it's good because we're a lab, an innovation lab, and we've great bosses and we get to go and kind of we're all our own bosses. So as long as we get the project done, we've really good structure above us to give us that shelter, really, to give us a safe haven to be able to do it. And the main thing that we do is open innovation. So it says here just involving users and citizens at meaningful stages of the process or the project. And what we're finding a lot in government at the minute is that everyone is using co-design, co-production, co-creation. And actually nobody's doing it. So co-design is brilliant if it's done well, and I wrote a blog about this lately because it really was starting to annoy me that I was going to so many of these co-design workshops, and actually what it was just a normal workshop, but we brought a service user with us, and then it's called co-design. And I'm like, but you're not actually designing anything, so why are you calling it co-design? So what we do is we understand the need for observation. We need to understand the need for going out and interviewing people. For a couple of projects, I went out and sat in people's homes to understand how they were using their medications. Sitting in front of somebody's fire covered in dogs one day, just, having a chat with this elderly lady because she had nobody else to talk to. That's what we do. We involve citizens at meaningful stages. Also, your users are not always your citizens, and sometimes I think we forget that. So sometimes your user could be your healthcare professional. Sometimes it's actually just your policy owner. So it's not always citizens at every stage. So getting that stakeholder and user journey map and everything right at the start is really, really important. So the methodologies we have in the lab, one of them is system dynamics modeling. Has anyone heard of system dynamics modeling? No? So it's crazy. This is systems thinking on steroids. And instead of just thinking about the whole system, this is using computer software to actually map out your whole ecosystem and put equations in the background, so you're actually getting a picture of everything that's happening, all the leverage points, all the resistance points in your policy, in your service, so that if we prototype or change one area of that policy or system, we actually know what the influence is going to be on the rest of your system. And a lot of people don't do this, especially when we're looking at healthcare. When you change a service, say you give a GP an additional service, it's about understanding the pressures on the GP structure at that stage and trying to mitigate against that as well. So Sarah Wiley, who's our systems modeler, was brought into the lab at the same time as me, and we work really closely together because when she maps out the whole ecosystem of a project, she can see areas for service improvement, and she can also see areas where people are using services that actually haven't been designed yet. So then I come in, swoop in like a ninja, and try to design those services. And the other thing we do a lot of is behavioural science. And at the start, behavioural science was a very siloed sort of team in the lab. So it was about looking at how people make decisions, why they make decisions, and how can we influence the decisions that those people are making. And it started very much on changing government letters, because has anyone seen a government letter? They're not that great. And there's very little behavioural stuff in there to make you pay your rates bill, book a GP appointment, whatever you have to do. So they looked at that, and that was very successful in just changing, and it's maybe not behavioural design, it was content design, because content design is really important, you know. So, but actually using behavioural science in service design is amazing, because you need to understand how you can influence people's behaviours in service design. Okay, so on to that then. So when I say I'm a designer, and I come from a product background, an actual physical product background, everyone thinks that it's how things look. So everyone thinks that I'm a graphic designer, and I am no way a graphic designer. I can't draw. I'm terrible. And if you ask a designer what design is, they'll give you an awful answer to it, generally. But it isn't about how something looks, it's about how it works for the user. And these aren't my slides, because one of the guys I work with is obsessed with cats. So he made sure there was a cat in the sort of lab presentation deck. But anyway, I think it's meant to signal really frustrated people looking or navigating through services, especially government services, online. Okay, so what is service design? And this is a really maybe academic and long definition of it. So activity of planning, organising people, infrastructure, communication, marketing, material components of the service, to improve the interaction between the service provider and the customer. And then the purpose of service design methodologies is to design according to the needs of customers or participants, so that the service is user-friendly, competitive and relevant to the customers. So that's really academic. GDS had this definition, which is service design is the design of services. Woohoo! Okay, so to a user, a service is simple. It's just something that helps them do something like drive a car, book your MOT, buy a house, you know, become childminder, get a job, whatever else it is. And the main aspects of service design are that it's user-centered, that it's co-creative, another I hate this, so that you should involve people at every stage of the process. Sequencing, so that visualization of key touch points in your customer and your user journey. Evidencing, so customers need to be aware of the service. I always said that services should be invisible, that nobody should know, if your service is designed really well, nobody should know they're actually going through a service. So that's what we work really hard to do, that it's just flawless and it's just flows and nobody knows that they're doing it. And also that it's holistic, so it takes into account the entire experience, from the moment you know that you need the service right through to you use it. And I get this all the time. A lot of people are talking about how it's different from UX. And I've talked to a lot of UX people who are now being put into service design. So have been told, right now you're a service designer, go and learn what it is and do it. And actually it's really different. So this is one of the best diagrams I've seen that sort of sums it all up. And I'm not digital. And I was saying to some of the guys, my life is going crazy from coming into the digital space, because you guys are all evenings and weekends and engineers are really not. So there's so much more going on. But so user interaction design and UX is really the digital touch points. And actually service design takes in the whole analog. So you don't have to code, but you need to understand how the code works. You need to understand what the touch points are in that service, so that you can do I always call it the wraparound service. So the small service is the interactions, the wraparound service is everything that service designers look at. Okay, and you're going to hate me for putting this up, because I've been to so many meetups lately where there's kind of a fight between products and services. And I have had so many different definitions of what a product is and services. So I'm only putting this one up just to kind of spark maybe conversation or debate or discussion. So products are tangible, like furniture or appliance, the table, my water bottle, everything else. That's the world I've come from. That's the product world I've come from. And it took me a long time when people said they were product designers to work out that they were talking about tech. Because I was like, oh no, you make shit, like physical stuff, you know? And And my view is changing slightly. Services then are intangible, so legal, medical care, repair work, anything else that you can think of as a service. So to me, it used to be that I thought that that any of that sort of product stuff in tech, websites, all of that sort of stuff was still a service. And slowly I'm like, well, actually, maybe services are products too, but maybe we sort of have products, and then we have tangible products and intangible products, and then we have services and goods. Maybe. I don't know. Like, everyone's got their own view of that. I don't think it's wrong, no matter what you think of. But I think that even product people have to think about the service as well. You know, it doesn't have to take away from the product. I think you just need to think about the whole customer experience from start to finish. So you can have a debate about that later. I'm going for my 10K run, so I'm not going to be here to have a chat about it, but you can. So I'm going to go back to customer need, and the biggest thing about service design is understanding your customer need and getting the solution right for your customers. And I always kind of put this up because it's amazing to me that 42% of startup failures is down to there's no market need. So when somebody comes up with a great idea and says, I'm going to do an app for this, or I think a website would be brilliant for this, and actually they put it out there and nobody uses it, because no investment is really gone upfront into understanding and defining that user need first. So that is not just the same with startups, that is the same with big organisations as well, and particular government. And this was really shocking to me when I was at the Service Design and Gov conference. This quote, and I put this up at Beltech as well, and it was the previous head of GDS said, in the first 10 years of this century, it's estimated that the UK government alone has wasted 50 billion on IT with a predicted 60 to 80% failure rate. So that's kind of higher than startups. You know, so that's crazy. And you kind of wonder why that's happening. You know, is it because we're not looking at the service holistically? Is it because we procure an awful lot of tech in and maybe our system requirement spec isn't right for that procurement? Is it because we rely on only a couple of organisations in that procurement list and we don't diversify into other organisations that could give a better service? So that was scary, and I'd say that 60 to 80% failure rate is in Northern Ireland too. I think it's the same, you know, I don't think it's any different. Now, that is dropped in this 10 years, but that's what it was like in the first 10 years of the century. So what are we doing wrong, or what are we doing right? So this is the sort of design thinking process for Stanford D School. Again, service design is different from design thinking. A lot of people are doing design thinking workshops at the minute, and it's very much about creativity and stuff, but it's not the same thing as service design. Service design is a lot more technical. But it follows the same sort of structure. So it's empathy. So how do we empathize with our customer? How do we put ourselves in the customer's shoes? And that is not about just going out and putting a survey on. I never know my customer until I sit in a room with them. And actually, the ones that voluntarily come in and do surveys and focus groups for you are very activated people who know government inside out and know services inside out, especially in healthcare. And sometimes they're not the best people to ask for you to be able to get your service right. Define, get the solution right. So if we did those first two in procurement of tech, we should be able to get the right tech in at that stage. And then idea generation, prototype and test. So at the minute, we're starting to do this. GDS have over 600 service designers, and that's not including the ones in HMRC and LPS and all of those different organisations. Up until recently, I was the only one in the Northern Ireland Civil Service, and that wasn't like a, whoa, I'm the only one. That was a really painful, oh, I'm the only one. And we just got another guy in who's our chemical engineer. He's being trained up now in service design, and I've just heard that LPS are starting to look at training their staff to become service designers as well. And in digital transformation services, I know that they're trying to retrain a couple of graphic designers in service design, so we'll see how that works too. We're okay at doing this. Loads of people can come up with really good ideas. You know, we're good. There's loads of mechanisms, methodologies for idea generation, so that's fine. And we're definitely not doing this because when something gets to prototype, believe you me, that decision has already been made. And I used to say this and go, oh, I don't believe that. No, they'll definitely, there's a beta, they're going to test it and they're going to redo it, it's fine. And somebody said to me, no, a beta means it's going live. There's going to be no changes. And I would love to say that's not the case, but actually everything that I've worked on, that is the case. So it's not about that, prototype cheap or fail fast and, to succeed sooner and all of those great quotes. But actually, this is what the lab tries to do with every single project, and we get stuck. That's what we're there to do. And we totally get stuck at the start, and we get stuck at the end as well. So, and the title of my talk was sort of this interaction between the online and the offline, and I have sort of said a bit about it the whole way through the presentation, but I wanted to put this quote up there as well, which is the whole Service Design in Government conference this year was about this, about connecting the technical people with the non-technical people, the service people with the product people, and to see how they can interact with each other. So we need to stop thinking about it as two separate entities. We need to start thinking about a holistic view of the whole thing, and sometimes that's difficult, and it's sometimes difficult for the service people, and it's sometimes difficult for the product people as well. Service designers are meant to be that bridge between those two worlds, and I'm loving the fact that people are interested in this now. Because we should have been interested in years ago. It's not a new thing. Sort of methodology maybe there was a name put on it in 2009, really, or probably in the 90s, but actually service design went back a long way before that. And I always put this up because this is why I'm saying it's hard. So this is the nested growth spiral. And really, so the axis here is about how hard it is to do, really. So exploring, generating ideas, developing, testing are kind of easy. When you start getting to delivering and implementing, growing and scaling it and changing systems, that's really, really, really difficult. So great ideas stay small, and we try to focus on those small ideas that we can get through the system without anyone knowing that we've done it. And old policies and old programs and legacy systems survive because we can't change them. It's so difficult. And actually these are the ones that people are complaining to us about all the time. These are the project sponsors that come and talk to us. Generally, they're talking about these old legacy systems. And it's just very, very hard to change that. And I finished in the lab in September, and I really thought in 2.5 years I would have had some influence maybe on this bit. And I haven't, and I just have to put it down as a failure. But actually, I think it's going to be a long time before we start influencing those big, big system changes, especially in government. So I don't have long left, but I just wanted to take you through a really quick case study. And we've worked on everything from an online feedback system for health and social care, like a TripAdvisor for health and social care, which has gone through the sort of 10th business case. And again, it's like legacy stuff, so it's hard to change. We've worked in the councils on recycling, doing small nudges, try to get people to recycle more. We've gone into look at the transformation of the court systems. We've looked at various things, but actually the only project for me that has gone straight from that sort of empathise right up to the scale up has been the pain management project that I've worked on for the last sort of 1.5 years. And actually, let me go back. And these are the people, only a very, very small percentage of the people that I went out and talked to about this. People with endometriosis, people with arthritis, people with fibromyalgia, people with back pain. Pete in the top right of the screen here, Pete had a C4 spinal injury from a motorbike accident and then medical negligence. It turned out that he was in a wheelchair for the rest of his life. I went out and talked to so many people about what resources do you need to be able to help you manage your pain? Because pain management in Northern Ireland is growing, but we also don't have the services to support the number of people living in pain in Northern Ireland. 1 in 5 people live in pain, constant, persistent, long-term pain in Northern Ireland. So we need to be able to empower those people to self-manage their condition, even if it's just to do a bit of yoga, even if it's to go out for a short walk, even if it's to join a walking group. Even if it's to understand how they're taking their medication and how they can change how they're taking their medication. So we knew that they needed a technical solution, but we didn't know what that technical solution was. So instead of ram-stamming into some sort of website or information service, we decided to do a hackathon, and that's where Code for Good comes in. So I'm a voluntary member with Luke McNeice and Russell Kane and Simon Hewitt and Owen McFadden from Economy. So we are all just a voluntary group sort of running hackathons for public good and social good. And we brought these people to the hackathon, which a lot of people didn't like. A lot of the techie people were like, whoa, you're making us talk to service users at the start of a hack? What are you doing? Like, it's crazy talk, But actually, everyone got up at the end of the day and said we had a solution in our head when we heard the title of the hack in the morning or before when they had signed up. And actually our solution completely changed once we talked to the service users at the start of the day. So that was amazing for us. Even if nothing happened after that, I would have been happy just at that response from the tech people. So we had an app which was a community of people living with chronic pain in Northern Ireland that sort of joined you up together. We had a virtual reality kit. I don't know if anyone knows Deepa Mankar. And Deepa made a virtual reality a sort of app for mindfulness so that people could go in and be in a forest and the leaves go up and down in the forest when they breathe. So it tries to control their breathing. And it's something that physiotherapists have been really interested in because that's something that they could maybe have in their physiotherapy and be able to sort of put people on and see how they interact with it. And we had a pain management app, and we had sort of another, actually back to sort of normal service, like a 24-hour helpline or something, call centre thing. But one of the main things that's come out of it and has been implemented is that this is NI Direct, and Zoe's worked in NI Direct before, and this is great for transactions. So it's a transactional website. You're only allowed one video on each page. You're not really allowed pictures. There's style guidelines, really, really strict style guidelines, and that's great because people go into it and know this is NI Direct and it's a government website, and that's brilliant. But actually what that doesn't do is meet the needs of chronic pain sufferers because they find it very, very hard to concentrate on long reams of text because of their pain. So they needed something more interactive, they needed videos, they needed pictures. So this was coming up, which is the new government information site called MyNI. And from the hack, we were able to get a beta campaign on this. And we asked service users to come up with loads of ways that they cope with pain. We got healthcare professionals involved, and they come up with loads of amazing ways to sort of empower people to live with their pain. And these are all the things. So there's reams and reams of articles, and you click into them, and it's very interactive. And so you can't click out to external websites on NI Direct. That's another thing. And actually, this allows you to click out to external websites. So that's brilliant for us as well, because there's loads of external resources from Australia, from England. So this was brilliant for us. And this is an email I got in yesterday from a physiotherapist from the Belfast Trust, Frances McGonigal. And Frances says that she'd just seen the website and she will make sure that she directs patients to it and keep up to date with the posts. And then the videos that we have done for chronic pain will improve the understanding of pain in our clinics. So you can read this. But this just made everything worthwhile for me. Now we've got loads of feedback from users and they're really happy, and people are saying that, this is really helping them, empower them to sort of try new things and to not keep on going back to their GPs. But actually, coming from a healthcare professional, it's even more important that the information we're putting out is right, it's trusted, that they're going to be directed, because that's part of the service, being able to direct patients to use a resource like this. So that's all happened in the last sort of 6 months. And actually, what we're going to do now is, instead of doing a kind of normal website evaluation, which is normally a survey, we're going to do a pain management day on the 5th of July in Ormo Baths, and we're going to invite support groups in, and we're going to invite service users in, and we're actually going to give them those resources and say, can we contact you in 6 months' time to see if they actually had some sort of outcome for you? So not just you've read it and it was good information, but you've read it, you've done something about it, and you've actually changed your attitude or your behaviours at the end of it. And that's what service design is all about. It is about getting to the very, very end of the process and making sure that it's had outcomes for people. So that's it, that's me. Thanks a million. I'm ready to do my run. I'm die.
We have a minute actually for questions. I want to just open the floor if people have any questions about service design.
Yeah.
I work in local government at the moment, and we're currently doing a service redesign across the whole council.
Yeah.
And the biggest challenge that we found is changing the attitudes of the people in local government and who are about to, maybe do new work with the new services.
Mm-hmm.
So how do you get the buy-in from them?
Yeah. It's totally to bring them on the journey with you. So one of the main aspects there was that sort of co-creation, where before you start anything talking about transformation, you bring the champions from the councils. We work with councils all the time, and there are 1 or 2 people that we work with that are amazing, and they understand it, and they're willing to kind of convert some of the other people. And when we bring them with us from the very, very start of the process through to delivery, they have a chance to influence every stage. They have ownership of every stage. And actually, a lot of the times when we implement stuff, they take credit for it, and I don't care about that, because actually they own it, and they own it from the start, and we're only there really to facilitate the process. So it's to find your champions in each of those areas, which we try to do. Also to be picky about the projects you start with, because if you start projects with those champions, then you're more likely to get traction when you have really good outcomes. So you can go and present, this is the impact it had, this is how good it is for citizens, you know, et cetera, et cetera. And then when you go to the next really difficult challenge with the really difficult sponsor, you've something to fall back on. You know, you're saying, we've done it and it's worked and it went really well. So that's generally what we do.
Any other, one more question?
Hi, Rebecca.
Hey.
You say old policies and programs despite weak impact and weak evidence of impact.
Mm-hmm.
You're leaving your role,
Mm-hmm.
going, I think, to the private sector perhaps.
Back to private sector.
If you had a magic wand, what is the thing that you would change to change that outcome?
Yeah, well, it's to try to embed the methodology more in it. So first thing that I would change is procurement rules, which is probably not going to change. Second, I think that what government needs really to be able to shift this is more external people coming in, because civil servants tend to be so they're generalists, you know, unless you've architects or chemical or mechanical engineers. And I think sometimes they don't see the world from the outside, so all of that sort of stuff has been ingrained in their thought that these legacy systems just keep on going, so we have no influence on them. I think if we bring external expertise in, and I think that's where the lab is going to try to do, so even though I'm going, the plan is to bring somebody else external in to give another view on it. But I mean, we're 8 people and the civil service is huge. So we don't really have the biggest influence. But I think if they started to bring externals into a lot of teams, I think if there's service designers in every policy area, policy design, I think that's a big influence. You know, one of the policy areas we worked in, the sponsor said, I need a designer in every single one of my policy areas. And that would make a real difference to what people are doing. But I think first of all is procurement. Needs to change. I don't know.
If I was asked to improve a service,
Mm-hmm.
you know, within Northern Ireland, the first thing I would do would be to ask who's doing it better elsewhere.
Yeah,
Let's go
yeah.
on a holiday and see what's
Yeah.
going on. I mean, surely that must be the best part of it.
Yeah, so we definitely do full lit review. We travel to see what other people are doing. You know, we're constantly at conferences. You know, if we're working on a healthcare project, we're always around, well, maybe Europe anyway. The guys were just back from a design meetup in Chicago talking about this as well. So not only do we do the qualitative stuff, we do the quantitative stuff as well, and we try to get the data, and we try to go out and just like see what best practice is in other countries as well. But actually, the more influential stuff that we bring in is from local. And local people, but anytime we do sort of an insight report on our research, it has a wide range of research. We spend an awful lot of time doing desk-based stuff as well as going out and talking to citizens as well. So yeah, I mean, we're doing an EU project at the minute, an Interreg project, and we're tied with the Canary Islands, and I am absolutely raging I'm leaving because we have 2 trips to the Canaries to our buddy. After I decided I was going. So yeah, there's a lot of people do travel around to see what's happening elsewhere, and as long as you're going to the right things, I think maybe.
Are you going back to aeronautical engineering?
I'm not, I'm staying into service design, yeah.
So people can follow you at
Consultancy, yeah.
So you're actually working with private sector even? Or
Yeah, so I still do consultancy with private sector, but yeah, I spend most of my time in the lab, you know.
So cool, brilliant.
And it's been brilliant, invaluable, so.
Thank you